Hello everyone. Today we are going to discuss about male reproductive system, part 2. Part 1 we had discussed about the terminologies. Now let's see part 2. I'm Mrs. Jansi, clinical instructor at M College of Nursing. Today's objectives is, at the end of the session, you will be able to demonstrate the history collection and the physical examination. So this is the male reproductive system picture. So this is a urethra, penis, prostate, vas deferens, seminal vesicle, bulbourethral gland, epididymis, and the testicle. So we are going to see and discuss about all this in detail. So this is the adjacent structure. This is how it's located. Now, let's move on to the history collection. In history collection, first, we will ask for the present illness. Ask about its onset, severity, persistent or sporadic, whether it is, and its setting, factors, if any, that make it better or worse. What does the patient think is the cause of the problem? Yeah, underlying problem, what is the cause? That we have to inquire. And what he tried to do about it and what does he hope for. So then use the non-judgmental questions about sexual orientation, such as, are you in a relationship, or tell me about your relationship status, to know the underlying cause. So do you prefer partners who are women, men, or both women and men? The common concern is sexual preference and the sexual response, penile, discharge or lesions, scrotal pain, swelling or lesions, and problems with urination. The present history. Moving on to the present history, pain and lesions. You'll also have to inquire about the discharge, lumps, swelling, or any masses in the scrotum, urination pattern, and the sexual dysfunction. Moving on to the past medical history. So we have to inquire about the prior medical problems, what he is suffering from. So how they were treated and the results of it. When was the last time he had the testicular examination done by a physician or by self, and what is the result of it? And have you ever been tested for HIV or HPV, that is human papilloma virus, herpes simplex, chlamydia, gonorrhea, and other trichomoniasis. Moving on to the family history, is there any history of cancer in your family? And what is the type, if so, and which family member has got that? That is to be inquired. And the cancers of the prostate and testis have a familial tendency. Next is the lifestyle and the health history. So how many sexual partners do you have? What kind of birth control method do you use, if any? And are you satisfied with your current level of activity and the sexual functioning? Do you have any concerns about the fertility, if you experience fertility troubles? And how has this affected your relationship? And next is, what is your sexual preference? So do you have any fears related to sex, or can you identify any stress in your current relationship that relates to the sex? And describe the activity you perform in a typical day, and do you have any heavy lifting currently? And do you perform any testicular self-examinations on and off or monthly once? We have to inquire about that. And when was the last time you performed this examination? So this is about the history collection. Hope it's clear. And now moving on to the physical examination, part by part, as told in the earlier picture, we have to go and then inspect. So first, inspection, palpation. And in inspection of the penis, the skin and the purpures, the foreskin, also must be watched. So if present, Then retract the purpose or ask the patient to retract and show. So this step is essential for the detection of many cancers and the carcinomas. Smegma, that is a cheesy whitish material that may accumulate normally under the foreskin. So this is to be noted. And then the glands. Moving on to the glands, look for any ulcers, scars, nodules, or signs of any inflammation. Check the skin around the base of the penis for the excoriations or the inflammation. Also look for nits or lice at the bases of the pubic hairs. Inspect it for the discharge. Normally, there is none. Okay, if you retract the foreskin, replace it before proceeding on to the examination of the scrotum. Now, scrotum. In scrotum, inspect the scrotum, including the skin. Lift up the scrotum so that you can see its posterior surface. And the scrotal contours, note any swellings, lumps, or veins. Examine the scrotum systematically in the following sequence. First comes the testis, then the tunica vaginalis, epididymis, and the spermatic cord. Last is the inguinal lymph nodes. If the scrotum is swollen, first exclude an inguinal hernia descending into the scrotum, then sequentially examine the structures normally in the scrotum. Moving on to the testicles, grasp each testis with a gloved hand and examine the testis simultaneously. So determine the size, shape, consistency, and sensitivity to light pressure. Transilluminate each. Even if they feel normal, you have to transilluminate and check. So with a hydrocele, an atrophied testicle may feel normal. So what can be done? Use ultrasonography to distinguish between the intratesticular and extratesticular masses. This is about the testicles. Moving on to the epididymis. Locate each epididymis on the posterior surface of each testis. If it is felt as a vertical ridge of the soft nodular tissue extending from the upper pole to the lower pole. In approximate cases, 7% of the males, the epididymis develops anteriorly, that is anteversion of the epididymis, in which case the tunica vaginalis will be posterior to the testis. Next is the spermatic cords. So it is easy to examine the scrotal contents. So with the patient lying supine, palpation of the varicoceles is best performed with the patient standing. Compare the spermatic cords at the neck of the scrotum by compressing each cord between the thumb and the forefinger. The normal vas difference is a distinct hard cord that can be separated from the other cord structures. Trace the cords down the testis. A varicocele looks and feels like a bag of worms. How does a varicocele looks? It looks and also feels like a bag of worms when you palpate. So other palpable structures are spermatoceles, which are separate from and rest superior to the testis, and epididymal cysts. Next is the inguinal region. Here, the index finger is placed at the most dependent part of the scrotum, then is gently directed into the subcutaneous external inguinal ring by invaginating scrotum. So when the patient coughs or strains, a hernia sac will be felt as a tap on a fingertip over that area. A large hernia may feel like a mass in the canal. And last is the rectum. I hope it is clear. I would like to conclude. So we had so far discussed about the history collection and the physical examination of the male reproductive system. We would like to continue with the disorders in part 3. See you all in part 3 video. So these are some of the references which I had referred. Thank you.